And we're live. So it's usually a little slower start rolling in, John, as people realize that it's 5:30 and they tune in with us and they see that we're going. There we go. Facebook is just updating and alerting. I'm sending out info that we're going live. So this is our 5:30 p.m. Eastern Standard Time Tuesday webinar. And I have a very special guest with me today. I have John, and John is with Spectra Therapy. And he has a pretty amazing product. What happened 3 years ago at conference, I met him, and that's where we met the first time. And I happened to win one of the laser reps after eyeing them all week at conference. I won one that he had donated to the silent auction, and it was fantastic. It was so amazing seeing the change with Arrow and with the other dogs that we used with it, that whenever I saw him at conference last year, I bought like half a dozen of them. So, John, tell us more about what the heck I'm talking about. What is the laser wrap?
The laser wrap, it started out, I originally was marketing a handheld laser and a probe. And I had a daughter-in-law who said, I'm having this operation. And I'd really like to be able to help myself. And I said, well, use this laser 3 times a day at least, and do those 18 stitches on where you have to do them every day. And so she did. And after a while, she said, hey, Papa, what you ought to do is make this thing so it's like a tube top bra, and I can do this a lot easier. And it'll just do it automatically. And I said, you got a point there. So that's what we did. And sure enough, that was the beginning of this whole thing. And from that point on, we found out that the repeat treatments make a completely difference. It makes it a lot easier to give the treatment and receive the treatment because you can do it day or night spontaneously. But we ended up programming it so it does it automatically, and you can get a couple treatments per hour, and you can get those all night long. So you end up with equivalent of 16 laser treatments. It's very similar in concept to putting a baby in an incubator because they've been using mom's disposal systems for 9 months, and sometimes when they're put on their own, their lymph, liver, and pancreas don't kick in properly to make the proper fluids for the disposal of their own waste. They've been using mom's, and they put them in a light incubator for 48 to 72 hours. They don't put them in for 15 minutes and say bring them back tomorrow or the next day. They leave it in for 48 to 72 hours. It's sort of like when you cook a chicken. If you want it nice and juicy, you don't cook it on the stove. You cook it in the oven. And we basically created a portable incubator, and voila! Then came the laser wrap, and with that, as the years went by, we ended up making one for a little dog. And it works pretty darn good. There it goes. And, I back up a smidgen and you can see the whole guy. But basically, it's treating the shoulders and it's treating our back. All the acupoints for the hind quarter as well, including the hind quarter. And it treats the side of them. And lo and behold, it really helps our entire metabolism regenerate. It helps the point of interest. It really is treating the entire area of interest, and it's treating the whole dog all at one time. So it's like the best of all worlds.
Perfect. Yeah, and we've used it. We've used it on all of our dogs. We've used it on a bunch of dogs who've come in. It's great, especially for the service dogs, because they do so much for us that we need to keep them in the tip-toppiest shape that we can keep them. And I found that the laser wrap helps out with that tremendously.
Well, sometimes, it's just like any kind of athlete. After they get a good workout, they ended up developing a lot of lactic acid. And so if after their hard day of work, let's say they're clearing some geese off the airport or something or another, and they pile them all back in the van after they've been doing their jobs all day, they got a lot of lactic acid buildup, and to put it on and have them relax to help them dispose of that waste and replenish their muscles with fresh protein and oxygen, it makes a completely different dog out of them. They feel better. They sleep well. They sleep all night, and they don't end up with all that gas or like in horses, we also have it for horses, and when they get colic, that's a pretty severe thing. But if we treat the abdomens on the horses, we can lose the colic within a day or shorter, and sometimes 2 days it'll be gone, a severe case. And if you treat that abdomen for 8 days, they start to take them off ulcer medication if they really progress to a very nervous state, because it's FDA cleared for to decrease anxiety and muscle spasms. And so that twitching is basically the twitching in their gut when they have too much acid and the wrong stuff in there after a bad workout. So, or also, if that animal bruised itself and now there's what turns black and blue, that black and blue is basically like rancid protein that's swelled up around that knee or the hind quarter. And when that gets circulated, which the laser wrap will do, where does that go? It goes in the gut and stays there. So, you really want that to help the guy get rid of that stuff if at all possible, as soon as possible, make them feel better and have them heal better, because that blood's going through all of the whole system. So that's the way it works. That's the principle why it works so good on a dog. You're treating the whole dog just with one laser, and if the bigger dogs, you need a couple of them.
So we have a question. Have you seen any improvements in dogs with allergies by using the laser wrap?
Basically, it helps if the circulation helps with the allergy, fight off the bacterial infection. Yeah, if they take the meds, it'll help it'll improve the oxygenation of their lungs as well as their blood supply. We actually can see that in humans when we treat humans, like one who has allergies or one has asthma. We can help improve that within a few days. They breathe a lot easier, and the phlegm and that go away. So I don't know about the allergies themselves. I haven't answered that one before.
So if Jackie wants to try, she can go ahead and order one and try it out and see if it helps with the allergies. A lot of times we'll get them in, especially in the spring. Dogs who have allergy issues and they're on, their daily dose or 2 or 3 of Benadryl. So come spring, I'll have to remember that and try that out too.
Yeah, please let me know.
Yeah. So what are some good stories from people who have used the laser wraps with their dogs or with themselves or with their horses?
Well, one of the best ones that I got here recently was from it was actually a lady who got one of these laser wraps for her dog for dock diving. And that was a year ago, actually, and the dog did tremendously much better. And so she was going along, and she liked it for a couple dogs, and dogs did better jumping because it helped energize their joints. Pre-event, it would juice up their joints, increase their oxygen content, as well as it vasodilates the veins and the arteries. That means the wall thicknesses get thinner, and they get higher blood flow with less blood pressure. And so they come up to it very relaxed and ready to jump, and they do a good job. Well, I ran into her here this last January, and she had a problem with her arms and what have you, and we had a new sleeve, and so she used that. But I didn't know she worked for a dog hospital, and she took her laser wrap in for a dog that was going to be euthanized, basically, that after 8 weeks in the clinic, they just couldn't bring it around with no matter what they tried. And she put on a laser wrap. And lo and behold, after the first week, the dog resumed normal bowel from the dysentery condition. The second week, the dog started to walk and its hip dysplasia started to reside, and he got strength in his hind quarter, was able to move about, and actually was walking through the hospital on all fours, doing a job, putting on a show. And then the third week, the sores that were on his hind quarter disappeared. They were giving a bath every other couple of weeks. And so that's the best of all stories, that have happened. And that's one occurrence. So that's like the best. But the other one is back to the dock diving crew. last summer we had last winter, a year ago, we had a gal that was turning about 28 feet, 29 feet with her dog and was a good athlete. But by July, the dog ended up breaking the Guinness Book of World Records, hit 32 feet. And, but then to all of our amazement, yes, she did break the record, but she jumped 35 feet, 3 inches on Labor Day weekend. And so that's a 12% improvement. And so the good can keep getting better. And that was on the third day of the event. And so the dog's actually getting stronger because he's building strength and he's building muscle, as well as in total fitness and in total health. And so that's what this laser therapy actually can do is, versus some of the other therapies out there, it can really increase, and it's great for after stem cell injection and PRP injections because it helps that tissue coagulate, or not coagulate, actually the fibrous tissues form and the cells to multiply, which because of the ways laser therapy works with the mitochondria and the ATP and all that good stuff, but it does create the cells, and cells grow and the strength comes, and the results come too.
That's awesome. Is there a type of dog that this wouldn't be good for?
No, all dogs, little dogs, big dogs, old dogs, young dogs. In fact, not recently, last winter, we had one of the fellows from the IACP, Nelson. He ended up doing some testing on 2 sets of five dogs, and he really got some great results. He proved that he got them all from rescues, and they did some work with them for it was a 9-day test. And every day the dogs seemed to improve. They did a 10-mile run, and the ones that were on the weaker side by about the 4th day were up with the rest of the pack. In fact, he actually measured muscle growth on 2 of the dogs out of the 4, and because they were weak from sitting around and malnourished. The other thing, what it does too, is that if you have fear and all that, it's and some of those dogs are a little scared. They're a little timid because of maybe whatever they went through before they got into the rescue. And lo and behold, with them, it lessens their anxiety quicker, and within a day or 2, they warm up to the handler, because the dogs would actually sleep with this all night long, and that's how it was introduced to them, where they'd sleep during the night, and then the next day they would get up and they'd run, they eat good, and that was the whole thing, is their strength got built back up, and as soon as they had their strength, then they could play together, and they could keep with the pack. And it's like everybody, you like friends, and you like to enjoy them, and you like to play around. So dogs are the same way, that's for sure.
Perfect. So it helps with the physical. You said it helps reduce anxiety. Can you go on that a little bit more? So behavior, not just physical.
Cleared for improving circulation, and at the same time, as you improve the circulation, it increases the oxygenation of the area being treated. So if you're treating down the back, you're increasing the oxygen level of those cells by up to 10%. It was measured at Detroit Medical Center here in Detroit. They measured like a bicep, and what it was, I don't have a slide handy, but they actually would measure a bicep and what the oxygen content of that skin was there. And after your blood circulates through your body every 3 minutes, roughly speaking, 2 minutes and 40 seconds. And so the first cycle, after 3 minutes, it went up to about 15%. And after the second treatment, in the lung cavity, it actually went up 18%. But not at that, because the blood's being recirculated throughout the entire body. So it actually increased after time. So it went up 10% on the arms and 15% in the chest area, where was the balance point. So this does work. It activates the. I had a slide here. Oh, 1 second. It actually, if the cells are stuck together, there we go. Then the blue side, you know, they start out and they're clumped together, maybe in groups of 2 or 5 or 6, and after they're activated and charged with the photonic energy, they break apart. Now they're able to go through and slide through the veins quicker on the return path. And at the same time, as those cells go by your lungs, they end up picking up oxygen. As they go by the stomach, they pick up protein. Then they deliver that to the muscles. I think it's really a basic system where you got these little carriers going around, but if they're clumped together, they pick up 15% less protein to be able to deliver to the muscles, and it picks up 15% less, 10 or 15% less oxygen to be able to deliver because they're stuck together. Once they're blown apart, that works one way. And then at the same time, we're vasodilating those arteries, which means the arteries in the veins actually get bigger and they widen up and they have improved blood flow. That's why and how we do it at both the cellular level, but also at the area level, where we're doing the shoulders, the hindquarter, and all the muscles down the back, down the spine. Well, lo and behold, that guy's really getting a good treatment. It's like a therapy treatment, and that's why we ended up coming up with the saying rehabilitation on the go, because that's really what we're giving them, is that as we're giving them a treatment, and they're also running at the same time. So they're utilizing it and they're improving their strength at the same time. Everything's happening at one time. So you don't have to take them to a specific rehab session. You can just take them for a walk. Take them for one in the morning, take them one in the afternoon, one in the evening, and will only hold, you know, their meniscus repair and things like that will repair a lot quicker. So after post-op, this is a great time to have these too, because your dog needs as much help as he can get as anybody does. And humans the same way. And that's what ends up happening, and that's why it happens. And so rather than treating, you know, a spot treatment one at a time, wherever it may be, and you end up with just delivering one treatment to that animal, and then you do it again a couple days later, well, you put on the wrap, the dog lays down, loves it, rests, and he gets a treatment. He gets 16 of them all night long, 2 1 hour. Or we have another mode where you can get 3 per hour. If it's at an event and you're taking in, you got a group of dogs, you take the best from one dog to the next dog to the next dog. They run, they jump, they do agility, whatever that may be, and or clear an airport of geese, and they put on after it to get rid of the lactic acid. So then when they rest, they don't have that anxiety and those acids in their system. They screw up their system that gives them those pulsating and sometimes muscle spasms or colic of type. And so they rest better. Well, I found out with older people, as I'm getting there myself, well, lo and behold, if you get a good night's sleep and you get good 6 hours and you don't end up with indigestion getting up in the middle of the night, or you don't end up with pain in your hip or knees, and you sleep all night, you feel better the next day because you really created more energy to use. And that's the same for your dogs. So that's what they need when they're recovering, and that's what they need for endurance or for strength or for performance. So it's like the best of all worlds, to tell you the truth.
Okay. Perfect.
And it's hands-free. You don't have to do anything. You put the
I like that.
It's no, you don't have to spend another $50 or $100 for a script. You just plug it into the wall, it recharges like a cell phone, and you're back up and running within a couple hours. So, you know, that's what it is. It's simple.
I have a friend who got the laser, the red laser stuff for her dog, right. And she has to wear the special glasses, and he has to wear the special glasses, and you can only do so long for the treatments. And I got her one of the laser wraps, and she said about how wonderful it is that her dog does so much better with it, that she loves that he gets the multiple treatments at a time, and he liked it so much last time he didn't want her to take it off.
Oh, I've had him where you put it on. In fact, I've had it wear a horse after I treated him once or twice in a barn situation. When I walked up to the horse lifted up its leg like a dog gives you his paw. And he wanted the leg wrap put on his leg. And, you know,
Yeah.
I mean, that's really pretty good. And the same thing, I had another gal I was talking to, and I had the coat on the dog, and the dog came on over to me after about 15 minutes, and I was sitting in the chair, and the dog just laid across my feet. So, I mean, they're saying like, hey, thanks, I appreciate it. And
Exactly.
you don't need the Elizabeth collar or anything with this thing either. You know, dogs are smart. They know what they want. Horses are smart. They just wear, you know, they love to wear it, and they're all set. Now, people, you know, if it doesn't match the outfit, sometimes they don't wear it. You know, I don't know. You know? So, but at the same token, it does work. So,
it does.
It works.
Yeah, I was using the dog's vest on my knee. I have knee issues. And whenever I saw you last year in Clearwater at conference, I got one of the knee wraps, the special knee wraps, and I used that. So my knee went bad in February, right before I went to Nipopo Silver School in Missouri, and I had to use a cane. And I'm thinking, are you kidding me? I'm going to a dog, you know, school with a cane. So I also brought the laser wrap. I brought 2 batteries, so one was charging while I was using the other one, and I had my glowy red knee for the whole week. But because of that, it didn't take as long as what it would have normally to get it fixed up. So that was amazing.
That's good. That'll work. Yeah, if you stop and you think about it, and you look outside, you know, nothing turns green without water, protein or fertilizer of some type or another, and sunlight. You know, they don't vibrate the ground, they don't electrically shock the ground, and they don't, you know, magnetically pulsate the ground or something in order to make trees or grass or anything that grow. It all does with light. And light has that, activates this mitochondria and the ATP in the cells, adrenaline triphosphate, which is your cell's natural energy. And it really does an excellent job, and it goes right through the tissue. And so, you know, like if I was treating my finger, and you know, it's going through, I'm treating the bottom side of my finger, but it's coming through the top. So it actually is treating everything. It's treating the bone, the periosteum around the bone. It's treating the joint, it's the tendons and the ligaments. And when you wrap it around a leg, lo and behold, you're treating everything to do with that knee, you know, inside and out, and all the blood coming in and going out of that knee. And you got rings of light that do it, and lo and behold, you know, it works a lot better, and it works a lot faster. And basically, you know, you put it on, and I don't know if I can show it down there, but basically you have like 4 to 6 rings of light going around your leg. So you're treating the veins wherever they are, the arteries wherever they are, you're treating the joint, and you're treating the bones. And, you know, you're treating it about 4 times going down, you're treating it 4 times going back up. And so everything going out to your toes, once you get it moving, it helps your toes. Even though you got a toe ache, you don't even have to treat the toes. It's the blood that's going to carry it. If you stop and you think about taking medicine, well, what are they doing with medicine? They take it, and then it's supposed to get there. Well, if it's swollen up, it doesn't get there. So therefore, the pain doesn't go right away unless they do an injection. So they get it in there for sure. With this, we can help medicine get to the delivery point, because we clear it up to improve the circulation so it actually can get down there and do its job. If you're trying to kill bacteria or something, this doesn't really kill the bacteria. It help get everything moving. And then the medicines, the mycins and that, they can go ahead and kill the bacteria. You know, sometimes you can just use something as simple as silver too, and it'll permeate right through the skin. Colloidal silver, just spray it, and it'll go into sores, open sores. It's great, it heals quick, and it's relatively inexpensive, and you can just keep a bottle of it in the medicine chest, and it works. So
perfect. So one thing I like
side
to,
trip, if you will, you know. So, but they're not. They really do work. They work on some of these horses on some of the very severe sores that they get going in and out of a trailer, and
yeah.
or you know, out in the woods. So they bang them up pretty good.
Oh, I bet. I know the dogs like to take them. Sometimes when they're wearing them, they feel so good they want to run around outside, and they get them a little bit dirty. So one of the things I like is that you can, you know, of course, take the battery off, but that they are wash machine safe, so they can look nice and pretty and white again instead of, you know, filthy little mud puppy.
If you go on the website, you go on the human one. It was designed so that they can be cleaned with the bed linens, like at a nursing home. To help with previous wounds and ulcers, leg ulcers, as well as people who have neuropathy in their legs, which are the shooting pains that they get sometimes, and also diabetic legs that have, you know, are painful. So.
Okay. Nice. And you were telling me, we were talking earlier. What's going on with wiener dogs?
Well, if you go to the website, the canine website of ours, you know, we've had about 4 of them so far where, you know, the dog comes in, it's got, like the one that's on the website, he got kicked by a horse, and the people came home after, you know, going out for dinner or something, and they found the little pooch just laying there with his brother, you know, scooting around, didn't know what his brother didn't know what to do with him, his brother being just another dog. But lo and behold, they knew Darcy down there in Florida, and she ran on over with a small laser coat and gave it to her, and it shows right there within 2.5 weeks, you know, they diagnosed it that you know, probably going to need an operation for $6 grand, and she wore the laser jacket and got 8 hours during the day, charged it 8 hours at night for the entire period of 2 weeks, and that dog was miraculously running again. I had another one up here in Michigan where it's the same thing, where, you know, diagnosed, and the brother of this, the father of this dog died at 4 years and so many months, and here the son now turned 4 years old, and same owner, you know, and she got all concerned, and again she used the laser wrap coat, and the dog popped back within about 3 weeks. And so it really, that improved circulation of the entire system, and the vasodilation, and I think sometimes the vasodilation is just not happening on the arteries and the veins. I think that it may be affecting some of the glands, and when you do activate the blood supply, it also drags along the lymph from the lymph cells, and so if you don't have circulation, the lymph can't flow. If the lymph doesn't flow, you end up swelling up, and that's the way you decrease your cellular at the cellular level, how you decrease the inflammation, and so it'll happen very quickly. On our website, I think we show, you know, like the horse's hoof. Oh, there we go. I think this is right. There we go. Well, we can decrease. This was actually my grandson's horse. He was riding a horse when he was 10 years old. He says, "Papa, bring out the laser wrap. My horse has got a bad cold and I can't ride him." And he couldn't ride the bigger horses, but he could ride this one. And we wrapped, at that time, all I had was the 3-inch by 40-inch strip. And we wrapped that around the leg, put a polo wrap on it, and within 2 hours, we decreased the swelling by over 2 inches. Well, now Schneider Salary, which is a $50 million a year salary out of Cleveland, Ohio area, Chagrin Falls, I think it is, they guarantee, you know, 2 hours, 2 inches in circumference. It will decrease from 12 inches down to 10, or money back. Never got our money back, never had to give them money back to give to a client, because it always works, because it's a basic principle that we're working on, and that's that laser light therapy. Versus LED therapy doesn't do what the lasers do. They just don't. It's the culminated light that gets delivered, has a certain energy, energizes the blood cells a certain way, and also we use the same wavelength, a 660 nanometer, versus like when you were saying before, some of the other lasers out there, they use infrared, which is more like a microwave type of a light frequency. And what that does is it bounces the cells together and the cells create friction. Well, that creates heat. Well, and so then with heat, you get inflammation, and heat's contraindicated for an inflammation. It's going to get worse. Well, you can also do brain damage if at some frequencies of like 810, and that's no good either. So they can only do it for so long, that treatment. But their need is they're paying somebody to put that in that animal, the clerk, and that's important to get it in quick, get you processed, and get you moving. And it does the job okay, but at the same token, you got to be cautious. On ours, you don't. It's like you keep babies in incubators for 48 to 72 hours, and it's safe because of the wavelengths of light, and we're FDA cleared for that, so that it is safe, and you can leave it on all the time, and you can use it on yourself, you can use it on your kids and everything else. As far as the light is safe, and it doesn't blind you either. You don't have to wear the dark glasses because the way we distribute the light out the filaments, that's patented, and that's one of the tricks to the trade of how we made it work. So, and it does work. So we're happy. Hopefully, we can make it
amazing.
And our listeners. So, yeah.
So Ann Baxter in Jacksonville here, trainer friend and fellow user. Whenever I won mine, I talked to her and she bought one that night. And then she bought a whole bunch more since then. She just posted, she said, I swear by this. I went camping and I got super sunburned. I started blistering and I put my gem more blisters, and it's the best product ever.
Thank you. I appreciate it. Yeah. She's a great advocate. It does work on burns. It's amazing on a 2nd degree burn where it's bubbled up, and you put it on there for 15 minutes and give it another 15 minutes for it to do its job, which is that lymph system, it actually, if you stop me and think about it, if you put soap detergent in the kitchen sink and you have grease, you got to let the soap cut the grease for a period of time. Let it soak a bit. And so that's what we do is we turn on the blood supply, we get it moving, and then we turn it off to let the lymph help dissolve the lipids, the cholesterols, the fatty that's in the blood, causing the inflammation that's stuck, why this thing's inflamed. And so then you turn that on, and so like turning on the faucet to spray the dishes off a little bit, you get some of the grease and you put it back in, you let it soak a little bit more. Well, okay. It's like an onion peel or an onion you got, if you're talking about the calf of your leg maybe, and this thing's swollen up above your knee. Well, you got to do where does all the fat go? You got to take it off the first layer, then you got to get the second layer, you got to get the third layer, and it takes some repeat treatments to do that. One treatment doesn't get it. It starts it, but it doesn't do much. You got to keep it going to get it all flushed out. Now, if you've had an ache and pain in your legs, like some of these diabetic people for a year or two, well, you're not going to get it out in 15 minutes, or you're not going to get it out in 1 week. You might have to do it for 3-4 weeks. And then all of a sudden you'll see the different results. The pain will go away. God gives us pain to say you have bad circulation. If you ignore it, it'll go numb on you. He likes to do that too. So but if you pay attention and you improve the circulation one way, shape, or form, if it's with meds or whatever you're going to do, massages, well, okay, that'll help it too, and then it'll get moving. So and your pains will go away.
Perfect. No, it works. It works fantastic for the dog. I don't have any horses, so, and I haven't put it on my cows, but it works great on the dogs and the people.
That's good. No, we put on a couple. They had them on a couple 1,000-pound drag horses, and you have to put a couple extra wraps on them, above down the leg, because they're a big animal. But if you think about it, we can take care of a 1,600-pound horse with a few of these lasers, and we can take care of a 200-pound diabetic, and we can take care of a 100-pound dog. And it really works. It's something that's safe, and it just consistently works. That's the beauty of it all. So.
Yeah. Yeah, no, it is. And I love the portability of it, that I don't have to, keep my dog in a certain position while he's doing it. Well, I can just put it on and all night long. I'm a really big Disney fan, and they used to have an electric light parade at night. So you just see like the lights. And that's what it always reminds me of. Zoe will wear it and walk around the house wearing it, and she's just like a little doodle bug on the electric light parade. But it's so nice, and you can always see them too at night. See exactly where they're at, so you don't trip over them.
Oh, that's right. Oh, we make a bed pad, and some people like that for their back. They put it's a 2-foot by 4-foot bed pad, and they put it in bed, and they swear by it. It lights up their night.
Right?
It does. But really, what works better is a conical wrap we have that you can light up, and it's like 26 by 9 inches. It comes with another 24-inch strap that can go right around your waist, so that it's there with you all night long. Rather than if you sleep on your back, straight on your back all night long, you're going to get a decent treatment. A lot of people don't do that. They go on their side. So therefore, that's what we got, the 4-inch elastic strap that affixes to it. And then they get a treatment all night long, and they get their good night's sleep. So, and that works for hips as well. Just as it does the dog's hip dysplasia. Well, how about people?
Right.
We're pretty close. We're just a 2-legged animal rather than a 4. So.
So what do you see as the future, besides everyone having a laser wrap for their dog and for themselves?
Well, yeah, that's basically it. They wear it. That's how I say it. That's like Dr. Chappell, who's on our website. He's a clinical director over 20 nursing homes. That's 2,500 people. And, some of the stuff you'll see there is that we really helped a lot of people really quickly. And we didn't do much. We didn't have much work to do, to tell you the truth. You put them on, and there was an elderly lady that was 80, and she had 2 raw heels that had sores on the bottom of them. She had some bed sores on her behind, on her tailbone in there, and within 3 weeks, lo and behold, sores were gone. After 2 weeks, they were healed 75%, and then after 3 weeks, she was seeing a wound doctor for over 6 months down in Boca, and then her granddaughter, who was sort of like taking care of her in general, had a job transfer up to Orlando area where the Doc Chappell's at, and hey, she brought Grandma up there, and that's the best thing that ever happened to Grandma. To tell you the truth, it's the best thing that happened to her granddaughter too. So she really enjoyed giving Grandma another good 5 years of life, and enjoying her all the way through. So that's the name of those games, and it's good. It helps a lot of people do a lot of things a lot quicker, and relatively speaking, very low cost. You don't have to make the trips to the places to see all the people and go through all the therapies. You just do it at home, and it's just more convenient all the way around. It's it just makes good sense.
It does. No, it really does. You were telling me that you're working with Amy Sadler with her Dogs Play for Life.
Yeah, because the key with that is that there's some dogs that need some help getting going, and again, in order to get that circulation going, they either got to be in a group of meds that require X amount of time per day and everything else, where this can help reduce some of that. It's hands off, actually. Put the wrap on, and 2-3 days, you know, it's sort of like what counts in, you know, days count in recovery, you know, rather than minutes here or that. And you got man hours too. And there's only so many volunteers for some of these shelters. And, you know, this is pretty straightforward. You just put the wrap on, and then 3-4 days, the dog's able to start to play. And once they get moving, it helps them recover a lot quicker too and build up some muscle, which they haven't been using, because if they've been locked up for a while, you know, sometimes it's pretty rough for those guys. And so that's the biggest benefit, and that's what we're trying to do with Amy and her, Sarah, and what have you, the people down there. And they got a program going on at a couple hundred shelters. So that's our goal, is to help her get this thing launched into her network, and do the best we can with her and the ASPCA and everybody that you know, however we can help, that's what we want to do to get it to go, because it's a safe way of going, and it's just a new way that's it's gonna go, and it's gonna come, and it's gonna keep going, and because it's just so simple. So.
What I love about using with the rescue dogs is, you know, one size can fit so many different dogs. So it's not like every dog needs to have their own, and then you need to replace it whenever that dog goes home. You know, a shelter can have a few, maybe a half a dozen or a dozen on hand, and just rotate them out on who they use. So that's fantastic for them, and all the dogs get to benefit. 1
hour treatment per dog twice a day or 3 times a day does the job, because we have the 3, what do you call it, the 3, 10 minutes on, 10 minutes off. You get 3 treatments per hour. And you keep it on there, and if you move it, it's just like you take medicine. You take medicine every 6 hours to get it in your bloodstream, to get it dissolved and starting to move. Well, it's the same thing with this. You got to do it morning, afternoon, and evening to get it moving. It depends how long it's not been moving. But I'm just saying in general, you eat 3 times a day, if not 4.
Yeah.
And then you do the rest of it, get rid of it and everything else. Well, those processes have to get up. And when you see these dogs that are lethargic and they're just not moving anymore, and usually they're older ones, or they're like a crabby old dog. We had Cindy Duan, who helped us initially evaluate this whole thing. And she knew it was going to help the performance dogs, and she knew it was going to help in handling, but she didn't know how it was going to help these old guys, crabby old dogs. Well, you know, here it is Thanksgiving, and, you know, the grandkids come on over the dog, and the dog says, you know, I'm not feeling good. My hips hurt me. I can't get out. You keep wanting me to play. I can't do anything, guys. Leave me alone. And then they snip at them. And so they end up getting at a shelter or at the kennel for the weekend at a bow wow or something or another, because they don't want the biting the kid. Well, you know, she put the coats on those kind of dogs, and she did 8 dogs, and lo and behold, she found that, you know, after a couple of weeks, the dog had an attitude adjustment. And she's the one that became up. The most important thing this code does is that it reduces anxiety, and then it changes the dog's temperament, because he wants to be nice, but he's in so much pain he can't be nice. And if he's got gas and dysentery, well, he doesn't feel good. He's just like an old man that's sick. It's got to run and can't get there because his back hurts and everything else. You know, it's just like common sense. You put yourself where the dog is, and lo and behold, that's why this thing is so amazing, because it does do it, and it does it repetitively. You can count on it in case, unless you don't know something different going on that's really severe, that's out of the realm of normal. Even like Nelson down there had a dog with degenerative myelopathy, which is common for some of these police dogs and the shepherds and the Malinois. Well, lo and behold, you know, his dog was, I think, 16 years old, and he had been doing regimens for a couple of years on this dog with everything he can with meds and you name it. And You put the coat on it, and lo and behold, within a few weeks, about four or 5 weeks, that dog came around moving and moving good. He's still moving. It's been a year later. So, I mean, if he takes away the coat, it's sort of like taking aspirin or something or another for your arthritis pain. You take them, you take them for a few days, get it in your system. It's good for 5 or 6 days, and then you got to take a couple more to thin out your blood is why you're doing it. And in this case, we're doing the same thing. We're thinning it out. It's density, and we get it to flow more, and that's what is the improvement. So I have people with the horses, they do the same thing. They took a bad fall on the horse, and the horse took a bad fall too, because he was the poles on the jump. Well, lo and behold, she uses it. She's an Olympic jumper, but she'll use it 2-3 days before the weekend events, and she'll treat her horse the same way. And so then they go through the event, you know, with flying colors, and then she just mellows out for a couple days and then gets ready for the next weekend and the next series of events going on. Well, that's what you have to do after you've injured something or you're getting older. That's the name of that game. And this cuts down that expense of having to, you know, pay for extra stuff and consumables and that. You know, you can get by. It's just a repeat cost. You just turn the thing on. It's no cost. It's just put it on and go to bed with it.
Yeah. No, that's the best way to do it. Is you don't have to think about it. If I don't have to think about it, it's even better. That's
right. And then you just throw on the washing machine. It comes out nice, bright and white again.
Yeah.
So it works all the time. It's all made with polyester. The foam in it for the pads that have foam are polyester, or it's white air mesh, and it does an excellent job. So. And it's been around now for a few years, and so, you know, and they've been kicked by these horses. Some people, they just clean the thing with a garden hose, you know. That's how they clean them, but that's what they do. So we make it, we still live. So I guess we're doing it the right way.
Almost definitely, yeah. Mine's closing in on 3 years old, and it's fantastic. It looks brand new.
There you go. Good, thank you. I appreciate that.
So yeah, like I said, we love it. I put it on our new Malinois the other day on Django. He's about 6 months old now, and he was good with it, except he wanted to run outside, and I'm like, no, because I know I'll never see this again.
Okay.
Off now, but you know, all of mine love it. So it's really nice.
Pay a little more attention to it. It has a calming effect on the anxiety for them to pay attention, and then once they can learn from you what you're training them. Well, then they know they're in control. Then they know what to do. And that's why some of these performance dogs or performance horses is that they want to do what you want them to do. They love you as much as you love them. But if they're confused or if they're hurting, they got to take care of themselves before they take care of you. Literally. And they know how to do that. And if we can help them do that, well, then they pay more attention. And that's what we found by treating the abdomen is that, you know, they get rid of some of the waste. It's like all the stuff about detox. That's what we're doing is we're just cleaning that out to make room for the fresh to come in. So prior to an event, you flush out the old protein, reoxygenate the cells as well as fresh protein, and you help get rid of some of the waste. Well, now that guy comes up to that line, he's warmed up, ready to go. And he's ready to jump. He's very healthy. He's very strong, and it works. It's like we got a sleeve now goes all the way from the shoulder all the way down to the sleeve to the wrist, and it's great for pitchers in between innings because it can help keep that juiced up and keep the inflammation down. It's like if you're recovering from a knee surgery, it's the same thing. You can wear the sleeve for the leg and get the same thing happening where it doesn't build up the inflammation, and you can still keep doing your exercises, even if you're on like an X10 machine, you know, an automatic machine that's raising you up and down, and then you get the inflammation, you want to stop. If you don't get the inflammation, you don't have to stop, and you can get 130 degrees range of motion, and you can do it within a couple of weeks rather than months. So that's what you want to do.
Yeah, well, I had hurt my shoulder a few years ago. It was after a workshop, and I woke up and my shoulder was sore. No idea why. I hadn't worked an over exuberant dog or anything. It just was bothering me. And I waited. I tried some different things. Nothing was working. Nothing was working. After about a year of shoulder pain that started for no reason, the doctor sent me to physical therapy. 6 weeks of physical therapy, and I was starting to see some slight improvement. But then I got really sick, and I took off because it was just in a small room, and I don't want to get everybody sick. And the pain came back. I'm like, you've got to be kidding me. That was before I knew about LaserWrap, but holy cow, that would have helped.
Yeah, if you don't use it, you do lose it. I mean, that saying really is true. And like the people that do marathons and triathlons, they're always hurting something, and this thing helps them stay in condition. You think about a foam rubber roller, well, you're just beating it. I mean, beating the meat, if you will. Honestly, that's what you're doing. Versus the treatment and actually getting it going at the basic, medical level, rather than just the mechanical. I'm going to beat the daylights out of this to get that meat soft, tenderizing it.
Right.
Which is what they're doing. I mean, really, that's what they're doing. So,
yeah.
I was a 78-year-old lady down in Florida, and she had a laser wrap for her elbow, and she was using it and everything, but she ended up with a knee repair. In the first week, she walked with one of those walkers. Second week, she walked with a cane. In the third week, she walked right up to her on her gangplank for a 70-foot boat. But nothing, just walked up the gangplank, and she was ready to go. And lo and behold, off she went. But she ended up with a 130-degree range of motion within a couple of weeks, and so she was in pretty good shape. So
nice.
It does work. You can treat us older dogs with new tricks.
That's perfect. So I shared the link at spectratherapy.com is your website, and you have a canine, horse, equine, and a human section.
And I appreciate it.
People can get on, take a look, order something for them, order something for their dog, and get on that path to health and wellness. I love it.
You can also use the same unit for both the dog or the person. You can plug it into either one. And that's what's handy, because then you just buy $100 wrap for your knee, like you did. Basically, you add it, and away you go. So
yeah, and I use the same ones. I steal it from my dog's vest, and I put it on my knee.
There you go. That's what happens. Yeah.
No,
it's a dog for permission. That'll work that way.
Right now, and it's great for the service dogs. After a long outing or something extra strenuous, or even just a short outing and something not strenuous. Just to keep them working their best. Is we love to use those laser wraps.
Not good. I'm happy are getting your use out of them.
Hey, if they sit in the closet, they don't do anyone any good.
That's absolutely true. I sleep with one myself because I used to be a heavy duty smoker, and my lungs are clear. And they said I used to have emphysema, and I'm as clear as can be. And that's only after about 10 years of I've been clean now for approximately 10 years, and it was really pretty good to be able to do that, because it helps people that have breathing problems. It helps horses with EIPH, exercise-induced pulmonary hemorrhaging. And we proved that with Dr. Chappell's horses that he has for his daughter. And what we did is that the horses, normally they were running on Lasix, and they would start to bleed at about 9.5 seconds into the race. And of course, they're bleeding in their lungs, and then they would cough. What would happen? Okay. And by treating it with the laser wrap, that horse didn't bleed until 13.5 seconds, and the race was over at 13 minutes and 3 seconds, and 13.5 seconds. The race was over. As a 17-year-old horse that won the Florida State Finals in 2 years ago. So I mean, we did treat a old horse new tricks too. So that made history. That was pretty good.
Oh, that's so neat.
Oh yeah, there's miracles that are happening, and so when you apply that to human lungs, it really works about the same way. We can treat a gal if she's well endowed. I can treat her from the back. Instead, I go through the backside of the lungs, and then that helps with the breathing. And so that's what we started doing on the horses. We did it on the dogs, and that's how we learned it. It was, by treating their backs, we just do the backside of the lungs rather than trying to get in the front.
Yeah.
And it works just as well. And at the same time, we can get a hold of all those musculoskeletals going down on each side of the spine, which are all the acupoints for the hindquarter or for the hips or your sciatic nerves. And that we're all the same. We're just, basically we're all the same. So once you learn it on one, you can practice it on the other, and it all directly pretty much applies.
Nice. That's perfect. Well, so how can people get in touch with you? We've got the spectratherapy.com website.
And you can also do the...
Are you on Facebook?
The email. Yeah, we have a Facebook page, and we also have just the phone, the good old-fashioned phone for us older people. I like talking to people myself, but I can understand it quicker. But we can do the Facebook and that's what we're on so far. We'll expand more. Our biggest focus was to make sure that we had the same unit that could address all the different categories. Like on a horse, we'll have 7 lasers on the horse blanket versus equivalent to maybe, 1 on a dog or 2 for the larger dogs, the extra large dogs, when you get up to the Goldens and that. When you get up to 100-pound dogs, you end up with the 2 lasers because we run out of energy with 1. And so, on a horse we can have, another couple for the neck and then 1 on each leg. But we have no wires, so that doesn't, that seems to work pretty good. So
nice.
So they can reach us that way, and then we have a couple dealers out there, Schneider's and Big D, for the horse stuff, and we plan on expanding that line now from a marketing and sales standpoint. Now that we have all that behind us, and we have pretty much a very stable, high volume product line coming out, and we have it now, but it's just drop the prices some and give some incentives to try to make this thing really move.
Nice.
And get as many people as we can. So.
Perfect. That's the name of the game. And as many people, and help as many dogs and help as many horses as you can.
Sure. No, and the price now still is reasonable. They're like $700 for a kit, no matter who we are. Man, horse, or dog. But at the same token, that's still pretty reasonable all the way through for what you're getting in comparison to some of the other stuff going on in the marketplace. So.
Oh yeah, yeah. So perfect. Thank you so much for joining me tonight.
Thank you. I appreciate your offer to participate.
Good. And I cannot wait to see. Can you believe conference is like 2 weeks away?
Yeah, it should be fun.
I'm looking forward to it.
Yeah. Thank you much.
Thank you. I will see you there.
See you there.
Bye-bye, guys.
Take care. Bye-bye.